Hello and good afternoon, classmates. My name is Joanna Kern. So today I'm going to be talking to you about knowledge workers and what that means, as well as credible medical information. So as a knowledge worker, healthcare providers are known as knowledge workers. What they do is they gather the knowledge, the information, and they put it into practice. So there are three types of knowledge workers. There is knowledge consumers, knowledge brokers, and knowledge generators. So knowledge consumers are the new nurses, the students that are gathering as much information as they can to provide the best care that they can. And the knowledge broker is the person who knows where to find the information, the best, most accurate information, where to find that information. And the knowledge generators generate the information. So they are the expertise in their field, and they put the information out there for the knowledge worker. So credibility is very important when you are researching knowledge. You want to make sure that this is the best information, most accurate information out there. If you're a healthcare provider, you're either looking up this information to provide healthcare, and you certainly want to provide the best healthcare that you can to your patients, or you're trying to educate your patients. So I would hate to personally, as a healthcare worker, put out the wrong information for my patients. So in order to do that, there are two acronyms. There are RADAR, and that's simply, the acronyms are simply so you know what questions to ask when you're looking at a research article. So the acronyms are RADAR and CRAP. And I'm just going to go through the RADAR and tell you the similarities between the RADAR and the CRAP. So just if you can remember just one, they're both very similar, so you will know which questions to ask for your when you are searching that knowledge as a knowledge worker. So the first one is in RADAR is R. It stands for rationale. And the in CRAP, the P stands for purpose. So basically, same thing, rationale, or P, purpose. So the rationale is, what is the author's purpose of writing the article? Is the author, are they getting credit for writing this article, or do they have any bias bias on one side or the other? Or are they giving you all the information and then you can choose which information you need is most appropriate for what you're trying to accomplish? So R stands for, what is the author's purpose in creating this article? Is it to sell you something? Does the author leave out any important information to make only their point come across? What tone is used in the article? And then the next one in RADAR is A. It's authority, and CRAP, there's two A's in CRAP, the acronym. So the first A is also authority. So you want to make sure you know the credentials of the author. What field do they practice in? What schooling have they been? What is their background? Where do they work? So for A, for authority, What is the author's credentials? It is important to know the background of the author. Do they work for an organization or educational establishment? How many articles have they published? And then for radar, the D stands for date, and that also is very similar to the first C, or the only C in CRAP, which is currency. So in the medical field, information is always changing. We're getting so advanced with the medical field and, evidence-based practice, how we want to best keep our patients safe. So you want to make sure when you're looking at an article that it's within 5 years. And I always, when I'm doing research, in a specific area, I always try to pick the article that's the most current. Just because I think it's just so important in the medical field to get the most up-to-date information. And a lot of articles will be published and then they will be updated. So you might see that as well. So that's great. So you know that somebody's going back and looking and updating the information. So D stands for date. It is important, especially in the nursing field, to look at when the article was published or last updated. And so A in radar is accuracy. And the second A in CRAP is also accuracy. So you want to make sure that the article is best matched with your specific circumstance, or maybe you're trying to educate someone on diabetes or diabetes education, and you want to make sure that you're as accurate to what their needs are. So accuracy is vital when you want to make sure that you provide a needed resource. Is the resource still there? Is it, you don't want to guide somebody to a resource or a website or a reference if it's no longer available. And then the last R in radar is relevance. Also, the R in CRAP is relevance. So relevance stands for, it's providing you with knowledge in reference to your topic and assignment. It is based out of is your article based out of a different state or outside the U.S.? Is the information presented in a way that you can understand or that your patient can understand? Or is it presented with a lot of medical jargon that your patient may not understand? Thank you for listening. I hope you have a great day. Bye.